Greetings from Aster RV Hospital. I am Dr. Neeraj Balaini, Consultant Neurology at Aster RV Hospital. Today I am going to discuss about headache. Headache is a most common medical complaint. So most of us have experienced headache maybe once in our lifetime. So we tend to ignore it or we tend to overthink about it. So I today will discuss with you what are the points which if present along with the headache you have to consult your physician or neurologist immediately. So broadly headache can be divided into two, that is primary headache and secondary headache. In primary headache there is the disease is only headache and patient has headache and nothing else, no underlying serious pathology. So while in secondary headaches, there is some underlying serious disease which is lingering on and which is causing you headache. So how one will know that my headache is a primary headache or a secondary headache? So we have few points which I want to share with you by which you can know that the headache is a secondary headache and it needs to be taken care of quickly. So these points are as follows. I will enumerate one by one. So first point is any headache that is new onset, abrupt onset and severe. So any new onset, abrupt, severe headache is a secondary headache. So if a person has not experienced headache previously, one fine day he or she develops a sudden severe headache, then the cause may be serious and you have to immediately come to a physician or a neurologist. Next point is if headache is associated with systemic signs like loss of weight, loss of appetite, night sweats or fever, then it's a cause of concern and you have to consult. Another point is any headache that occurs that starts in pregnancy in females is a cause of concern. Headache in an immunocompromised individual, that is taking some medicines which affect the immune system, like patients with rheumatoid arthritis or lupus or SLE, they are taking medicines which affect the immune system. So headaches in such patients are not to be ignored and to be taken care of immediately. Then headaches in persons, onset of headache in persons with age more than 50 years. So if a person more than 50 years and he is having new onset headache, then it is less likely to be a primary headache and you have to evaluate that. Then any headache that is causing weakness of the limbs, arms or legs or decreased in consciousness of a person, it is a serious cause and you have to evaluate it quickly. Or headache associated with the history of cancer. So any cancer patient, if he or she has headache, don't ignore it. Please come to visit your physician or neurologist immediately. So these are some of the features which suggest that your headache is not just a simple primary headache and it is a secondary headache, and underlying disease can be serious. It can be dangerous to life or functioning of the brain. So for diagnosis of your headache, kindly visit Department of Neurology at Aster RV Hospital, JP Nagar, as well as for more information on headache, you can visit us at Department of Neurology, Aster RV Hospital.